Malaysia facing backlash over its new plans to bar teenagers under the age of 16 from having social media accounts.
Now, the new measure is set to come into effect from next year. The push in Malaysia follows a string of bullying incidents as well as scams targeted at teenagers. There are growing questions over how the government will be able to enforce the ban. The critics argue young people could pivot to VPNs and use foreign registered accounts to bypass the new rule.
Malaysia says it's studying how Australia rolls out its world first ban, which is set to take effect on December 10th. Now, from that date, users under 16 in Australia will be barred from having social media accounts.
Big tech companies are now rushing to implement systems for age verification. And some, like Meta, have already raised concerns that there will be a margin of error, with some children slipping through the net or some adults getting mistakenly caught up.
Indonesia announcing earlier this year that it would set a minimum age for social media users, but the government later issued looser regulations that would require social media platforms to filter negative content and implement stricter age verification measures. In Europe, France, Spain, Italy, Denmark and Greece are working together to test templates for age verification applications. Well, Dr. Annabelle Chow is a clinical psychologist and she joins us on the show this morning. Dr. Chow, thank you very much for talking to us. We know that you've long favored protection and guidance for minors on the use of social media. But is Australia, you think, going about doing it the right way? I mean, what do you like? And what makes you go, hey, I like that, and what makes you go, nah, that's not going to work?
I like the way that the governments are actually protecting something that's very vulnerable, because kids, before they hit 25, actually, their brains are still developing and they're very impulsive, and they, most importantly, don't actually know how to regulate risk. So I think governments are actually putting attention to something that is vulnerable and trying to protect our children. And this is very much in line with, as a parent myself, I want to make sure that my kids thrive and grow in a nurturing and safe environment. And I think sometimes the digital world can really open doors to lots of risks that they may not actually be ready for.
Okay, doctor, from your clinical experience, I wonder what could be the consequences of psychological, whether it be positive or negative, for teens who are kept off these platforms until 16.
So I think there's been a lot of research to show that higher screen time actually increases anxiety and depression. And so hopefully the experience of trying to put the screen time at a cap would mean that their mental health would be looked after. We also know that there's a higher level of irritability and emotion dysregulation, as well as behavioral issues like conduct problems and inattentiveness when they use screens at an early age with their developing brains. Most importantly, I think sleep is often the biggest casualty. When our kids are exposed to screen really early, especially in the evening, it disrupts their sleep quality and duration, and poor sleep then affects our attention span, our behavior and learning. So hopefully with the social media ban as well as the screen time ban, that would mean that they would have more sleep, they are less exposed to risks related to bullying and scams, and that helps them learn better and also develop better.
Dr. Chow, I mean, Australia takes this a lot further than I believe all other governments at this point in time. I'm wondering, how soon, can we draw lessons from what they're trying to do now? I mean, is it going to be a question of months? Is it going to be a question of years, decades? And precisely, what would you be looking for to gauge whether or not this is something that's effective?
So I think this is really new, and Australia is the first one to trial this template, and other countries are also following suit. I think it's really hard to tell at this point how much time is necessary. But I think what's really important to put focus on is the fact that Australia has realized that there's a lot of risk involved with children being exposed to social media too early. Like it affects them cognitively and even their social development. Children these days spend more time playing on their screens and social media more than like face-to-face interaction, and that can affect how they actually operate in society when they start working. So I think it's really hard to say when we can see the results, but I would like to think that Australia would be also reviewing in a year's time to see the data they've collected, and then we can take it from there. I think it's evolving research at this point.
And Doctor, there are worries of unintended effects and backlash. Some are talking about forbidden fruit effect, where restriction makes the online world even more appealing. What sort of advice would you give parents and young people to help navigate this transition and encourage healthier digital habits?
So yes, from a clinical psychology standpoint, overly strict or inflexible restrictions can unintentionally shape a child's behavior in the ways that we don't want. However, I think this is where parenting, communication, and values will come in. I think curiosity requires guidance, not secrecy. So, for example, even my kids come home and ask me about some things that they've heard from school, some things that they've learned from social media through their friends or discussions with their classmates. In these situations, I will open the conversations to ask them what they understand of it, and I will actually explain to them the actual terms and definitions of what these words mean. And I will also invite questions. Anything that they want to ask, I will be open to answer. At the same time, I want to be instilling values and boundaries. So, for example, helping them understand that, it's important that they be respectful, and using these words or being exposed to this content early may mean that they are not ready and they don't understand the hurt that they may have on themselves or on others. So, in that sense, understanding what it means doesn't mean engaging in them, and also keeping in mind like to keep communication open so that when they see something that they are curious about but may not be safe, they can come and tell you that I saw something strange online and we can talk about it. Lastly, I will also focus on what I can control. So the things that I can control will be the values I teach them, how they engage with the material online, instead of focusing on the things that I cannot control, which is the external environment and what their friends may be exposed to or tell them.
Okay, so this question I have for you, Dr. Chow, is one for parents who may not have a strong relationship with their kids under 16, as you may have. What would you say? I mean, how determined have you found these kids to be, when they want to have something they're not allowed to have? And how can parents sort of like deal with this?
Extremely determined and extremely adaptable. So actually, in conversations with a lot of parents that I work with, they've also shared with me that they were really surprised at how the children were able to get around the privacy locks that they have put in. And I think I advise them to kind of open up a conversation, invite conversations with their children, and to also let them know that you're concerned. So while in that situation, I would actually acknowledge and validate that they were quite intelligent in getting around things. But I would also start by explaining why these boundaries were put in the first place. And I don't actually think that it's necessarily a physical age limit, but it's more importantly, the parents need to assess whether they are mature enough or whether they are understanding enough of what they're exposed to at whatever age that they are. And that needs to be communicated to their kids. So, for example, if your kid is 10 and your kid is showing you that he's very, very mature and he understands the content that he's exposed to and what he's going to use it for or how he understands it or how it impacts on him, then you can have further communications as to how he can use it, and to increase communication patterns with communication gateways with parents. However, if your child is 16 and is still not showing that they understand how the digital exposure can be dangerous, then I would say more boundaries need to be put in place.
Some very useful tips for parents out there. Well, thank you very much, Dr. Chow, for being with us and sharing your insight this morning. We've been speaking to clinical psychologist Dr. Annabelle Chow.